Hello, my name is Dr. Vanessa MacGregor. I'm a consultant in communicable disease control, and this is Black Excellence. My job involves trying to prevent infectious diseases from spreading from person to person and also trying to control outbreaks. I also get involved in protecting people's health from environmental threats. So these are chemical incidents, radiological incidents, or threats posed by environmental hazards. And some of my work also revolves around planning for emergencies. So thinking, for example, how would we cope if we had a new strain of influenza that came into the country? So part of my job involves trying to plan for that scenario, for what advice we would give to people, what treatment we'll be able to offer, and how we would stop the spread of the disease. On a day-to-day basis, it can be very varied. We have what we call our acute response center, and on a day-to-day basis, lots of people call us, doctors, nurses, members of the public, schools, care home. They're calling us either to report to us cases of infectious disease. So for example, they might be telling us about things like chickenpox, measles, scarlet fever, diarrhea and vomiting. They're often asking for advice because they want to know what they need to do to stop the spread. So schools, for example, may want to know, do we need to close if they've got an outbreak of diarrhea and vomiting? What kind of cleaning do they need to do within the school to try and prevent the spread? We also get told about outbreaks. Sometimes, for example, we might be informed that people went to a restaurant to eat and now they're all sick and they think they got infected from the restaurant. So one of my roles would be to investigate that eating establishments to find out whether or not it's the cause of the illness. I also do get involved in policy areas. So for example, looking at the immunization program in the United Kingdom, for example, what are the best vaccines that should be used? How do we ensure that the schedules are correct, and how do we encourage people to receive their vaccinations? I do enjoy my job. It can be very interesting. It can be sometimes high profile, but most of it, I enjoy the sense that I'm helping people, that I'm stopping illness from spreading, that I'm keeping people healthy. And I like the fact that there is an aspect of prevention in my role, in that I try to prevent people from getting unwell in the first place. I was born in Nigeria, in Ibadan, but my family moved to Lagos when I was a year old. I spent most of my childhood and early years in Lagos. I went to primary school there and secondary school there, and I had a really good time there. I enjoyed it. After my O-levels, I was accepted to study medicine at the University of Ife, but my parents gave me a choice. They said, you can go to the University of Ife and study medicine, or you can go to England and do your A-levels. You can imagine which one I chose. So I came to England and went to St. Mary's School in Ascot, where I spent a wonderful 2 years doing my A-levels. But after A-levels, I elected to go back home to Nigeria, and I went to the University of Ibadan to study medicine. Growing up in Nigeria during the 70s and 80s was an interesting time. In the 70s, things were really good, but as the 80s came along with the changes in the political climate in the country, it became much more challenging. When I completed medical school, although I had wanted to stay in Nigeria, all the doctors had practically left. And I felt that if I stayed on, I wouldn't get good quality training. And that was what made the decision to come to England. When I came to England, I didn't originally intend to live here permanently. My idea was to get some specialty training and go back to Nigeria. But I came to England and life happened. So now I've been in the UK for nearly 24 years, In another couple of years, I'd have spent longer in the UK than I spent in Nigeria. When I decided to make the decision to come to the UK, I say I, but it was actually a joint decision. Just as I finished my internship year, I got married. My husband and I made the decision to come to the UK to get specialist training together. And at the time when I came, I was pregnant with my first child. We didn't really know what the system was like in the UK. The first thing we found out was that we had to do exams to show that we will be competent to train in the UK. And both of us registered for the exams. My husband did his first because he needed to get a job as soon as possible. Because I was pregnant, I had to delay my exams until after I had my daughter. My husband did his exams and got a job in Scotland, and he went to Scotland, leaving me behind in London with the baby. I took my exams 3 months after I had my daughter, and by then my husband then got a 2-year job in Peterborough. So I moved to join him, and then I started applying for work. But it immediately became apparent that I wasn't going to find work in Peterborough. The first job I got was in the West Midlands, so I had to leave my husband, take my 1-year-old baby along with me, by myself to the West Midlands. Childcare became the big problem. In the end, I got an au pair. I was very lucky. I got a lovely young lady called Adriana who came from Slovakia. She stayed with me for 2 years, and in that 2 years, we moved from the West Midlands to Essex. I was working in pediatrics then, doing nights and weekends, and she looked after my daughter and brought her up. And at times, my daughter was closer to her than she was to me. After that, I moved around a number of other places. The biggest challenge I had before I went into public health was that my husband and I never really lived together because we never managed to work in the same place. This was as a result of the medical system there. Because we were foreign trained doctors, we basically had to take whatever jobs we could, which meant moving around a lot. And I ended up working in the West Midlands, in Essex, in London, and my final job, pediatric job, was in Ealing. When I got into public health, my first job in public health was in West Sussex, and I was living in London. So I had to do a lot of commuting. Again, by this time I was on au pair number 5. My husband still was working in Wales at this time. Those initially caused some challenges, but when I got into public health, that was a 5-year training program. And after 18 months in Sussex, I was able to do the rest of my training in London. It was more stable, and we were actually able to buy a house, and my daughter could start going to school. When I completed my training, I got my current job, which is in the East Midlands. We moved my whole family up to the East Midlands. By then, I'd had my second daughter. My husband was working in Reading at the time, but after a year, he decided to become self-employed, and we've now been living in the East Midlands for the last 13 years. We've managed to achieve a work-life balance that suits both of us and our family, because we both work fairly regular hours, and so we can spend a lot of quality time with our 2 daughters. So one question I do get asked is what challenges I faced getting to my role. And when I think back about it, I don't feel I faced challenges because of my gender or color. Any challenges I feel I faced were more challenges that I set myself. As a doctor, I had to do lots of exams to get to where I am, and those occasionally raised challenges. But if I didn't do well in an exam, that was, I think, on me. I ascribe, I think, my feelings that I haven't faced racial discrimination, and maybe wrongly or rightly, to my upbringing in Nigeria. In Nigeria, we don't see things through a filter of color. You know, you're there, everybody is the same as you, and that's just normal. And I think that gave me a lot of self-confidence. You know, I never had to worry about whether my color made any difference. And I think even after coming into this country, when I came to do my A-levels, I was the only black person in the school. I think I was the first black person in the school. Because definitely when I looked at all the old school photos they had up, I didn't see any other black people. People were very curious about me. My hair especially was an endless source of fascination. But I didn't feel alone or strange. And I made some very good friends while I was at that school. And that's still how I view things. I still don't view them through color. I don't feel people judge me based on my color or my race. And I have to say, thankfully, I've never experienced direct discrimination. Nobody has ever come up to me and said, you know, go back to your country or things like that. But I think there is some unconscious discrimination in the system, if I put that a word. It's not direct, but there are barriers sometimes that are in place. And certainly as a doctor who didn't train in the UK, I found the hoops we had to jump through in terms of the exams, having to prove yourself sometimes time and time again, having to take whatever job was offered, having to almost be better than someone who was trained in the UK, because we had time limits placed on how long we could do certain things. If we didn't get onto a training program within a time limit, then your right to remain in the UK then became an issue. But I really believe that having belief in myself and willing to work hard was what helped me to get where I am. My daughters, they are young black girls growing up in a country of mainly white people. I think their experience is different to mine, and I sometimes have to try and put myself in their position and say, well, how will I feel if everyone I saw around me was pretty much white and there were only a few black people? I don't think it's affected them so much. My younger daughter is the only one, when she was in a primary school, where she was again the only black girl in the school. And she had some of the children teasing her because of her color. That was the only time I actually had to go to the school to talk to the teacher, to try and get the teacher to be supportive and to ensure that the children were aware of diversity. That was the only time, you know, I heard, I wish I was different, I want my color to be different. But actually that particular daughter, she's grown now, she actually now celebrates her difference and her diversity. She likes being black and different in the school from everyone else. I think it gives her a sense of uniqueness and makes her feel sort of confident in herself. I hope I've tried to instill with my daughters that despite their color or their gender, that they can do anything they want. All they need to do is have that belief in themselves and to work hard. And I think that's the same advice I'd give to any young person, is don't look at the world through a filter of color. Follow your dreams. If you want to go somewhere and do something, don't think your color is going to hold you back. If you fall down at the next hurdle, just get up again and keep going. Hard work, determination will usually get you to where you want to go.